Hi, my name's Jewel Knumprum.
I'm Aaron Exner.
I'm Justin Monasit.
I'm Naya.
I'm Yuji.
So we had case study A, which was about subject Mr. W. Kane. He is a 95-year-old male and lives alone. He has had multiple strokes in his life, and he suffers from strokes, dysphagia, anxiety, depression, aphasia, verbal communication impairment, loss of appetite, incoordination, inability to swallow, congestion, weakness, and mild dehydration. He has severe weight loss due to not being able to eat properly. He's on a specific diet. He currently is being watched by his son and daughter who lives in the same city. They visit him every day. He also has many nurses with him to make sure he is not bedridden. He is still well.
The main SMART goals is S, the outcome of the patient will be for them to function on a daily basic activities. M is Mr. Kane will be able to swallow food and communicate, to walk independently, and to feel motivated to continue future treatment. A, each healthcare professional will give Mr. Kane extensive treatment that will help him recover from the effects of the stroke. R, Mr. Kane will have to adjust to his situation physically and mentally since it cannot be reversed. And T, within a year, he should be able to perform basic tasks with minimal assistance. SMART goal number 2. S is Mr. Kane's mood will be improved and he will be motivated to continue with recovery and living with his condition. M, Mr. Kane will have more independence and consequently be content with his current situation. A, all healthcare practitioners will do their part to improve his condition and have him adjust to living life after his stroke. R, having a stroke with permanent effects and having experienced personal loss will have a negative toll on the mindset of the victim. Improving his mindset will have him feel motivated to continue. This can be accomplished with treating his physical conditions as well. T, his mentality will improve around 5 months in before he is finished with his physical treatment.
Okay, so first, Mr. Kane comes into the emergency room, so we have to diagnose Mr. Kane. So a neurologist will do that. So the scope of practice of a neurologist is to treat disorders affecting the nerves, spinal cord, and brain. Some disorders can be epilepsy, Parkinson's disease, Alzheimer's disease, or cerebrovascular disease. So the goal after Mr. Kane gets diagnosed, with the information we have from the test, is to determine if Mr. Kane needs surgical procedures, like on blocking clogged arteries. Okay, for SMART goals, S would be to remove blood clots from the carotid arteries to prevent future strokes. Once we get Mr. Kane's test results, it will determine if he needs surgery, and if he does, it will determine the type of surgery required. A, the diagnosis and procedure will take place the same day Mr. Kane's arrival to the emergency room. Or the goal can be achieved if everyone in the ER are working effectively to give Mr. Kane the proper care that he is required. And T, the time it will take to complete the task should be less than a day.
So the scope of practice for the registered dietitian is educated and trained in food and nutrition science and dietetics practices. And so for the goal for the dietitian, Mr. Kane will be able to eat whole foods with ease without the use of thickened liquids and only pureed foods. They supply services in many different settings, including healthcare, business and industry, community and public health systems, schools, colleges and universities, the military, government, research, wellness and fitness centers, agri-businesses, private practice, and communications. So the SMART goals for the registered dietitian S is Mr. Kane will eat eat foods high in potassium and magnesium that follow along with his diet of pureed foods. M, he will eat at least 3 meals a day, consisting a total of 400 to 420 milligrams of magnesium and 3,500 to 4,700 milligrams of potassium daily. A, every day he will eat liquid foods that are high in potassium and magnesium, and by the time 4 months is up, then he will have the ability to eat whole foods. R, Mr. Kane will follow a strict healthy diet consisting of pureed foods, mainly of fruits, vegetables, whole grains, and legumes. T, within 4 months, Mr. Kane should see an improvement in his overall health.
So for physical therapists, their job is basically to improve movement and manage pain, diagnosing functions and movements, creating individualized plans for the patient, using different exercises, therapy, and stretching to reduce the pain and allow more movement. They play a major role in preventive care, treatment, and rehabilitation, especially for those recovering from strokes, as Mr. Kane is. And they can also help decrease pain with the help of equipment like wheelchairs, canes, and walkers. They also record and evaluate progress made while reviewing medical history and notes from doctors and other healthcare workers, for example, a nurse practitioner. So for SMART goals, S, Mr. Kane will be able to be independent, which self-care, and have more coordination. M, make sure he is able to move with the use of a walker, cane, or wheelchair and be able to move independently rather than being monitored by a nurse and much other staff and being worried about him getting sores and not being able to move from bed. A, minimum of 3 times a week for an hour, he will go to sessions and work on his coordination and movement. R, Mr. Kane will be able to attain this goal as long as he follows his treatment plans, attends all the sessions, and does not suffer from further medical problems. T, at the end of a 1-year period, Mr. Kane should be able to maintain movement with little assistance and little pain.
Occupational therapy. Occupational therapy is very similar to physical therapy, but different. The scope of practice helps individuals who are recovering from a physical or mental sickness that inspires rehabilitation through daily activities that are necessary in life. Occupational therapists play a major role in having consultations and discussing treatment procedures with patients and initiating healing techniques for enhancing patients' capability to achieve basic tasks that are essential for daily activity. The goal of an occupational therapist consists of having the ability to diminish discomfort and frustration physically and mentally while using instruments such as walkers, mechanical chairs, cane, etc. Establishing and sustaining patient medical treatment reports and recording therapy sessions while collaborating with physical therapists and speech pathologists to conduct a successful treatment plan for patients. The SMART goal for an occupational therapist is S, Mr. Kane will become less dependent and complete daily tasks on his own. M, he will go to OT therapy sessions at least 4 days a week, and as he improves, he will be obligated to go 2 times a week. A, each OT session will be a little over an hour. Therefore, if he goes 4 days a week for an hour and a half, improvements will be seen. R, he will be able to obtain his goal as long as he works hard for it and is able to be more independent when completing his daily routine. T, after a year and a half, Mr. Kane should be able to complete everyday actions with little to no assistance.
To take care of Mr. Kane's mood, he'll need a clinical psychologist. The scope of practice for a clinical psychologist is to assess, diagnose, and treat individuals experiencing psychological distress and mental illness. They work to identify problems that may be emotional, mental, or behavioral in the patient and diagnose accordingly and create a treatment plan. Clinical psychologists only give talk therapy. They do not prescribe medication. And the goal, in this case, is to improve Mr. Kane's mood and help him cope with his current situation. They must also coordinate with the speech-language pathologist due to Mr. Kane's condition. The SMART goals for the clinical psychologist S. Mr. Kane will improve his mood about his current situation. M. Mr. Kane will go to weekly therapy sessions, 4 to 5 days a week, to discuss his emotions and thought processes. A. Mr. Kane will have a therapy session 4 to 5 hours per week with coordination from other healthcare professionals to keep him safe from harm. Topics such as grief and motivation will be discussed. R. Mr. Kane will be more open about expressing his feelings and accept his situation, and will be more motivated to continue other treatments. T. Within a year, Mr. Kane's mood will have improved and anxiety will have decreased. To take care of his communication, he will also need a speech language pathologist. The scope of a speech language pathologist is to provide services to optimize individuals' abilities to communicate and swallow, which is a result of aphasia. Communication involves speech production and fluency, voice resonance and hearing. They also develop tools and strategies to address memory, thinking, and communication problems. The goal in Mr. Kane's case will be able to communicate basic needs, even if they are nonverbal, and he'll be also able to swallow food. The SMART goals of a speech language pathologist for S. Mr. Kane will be able to communicate in a way that is possible with aphasia and decrease blood circulation to the brain. M. Mr. Kane will indicate basic needs such as food and using the restroom and be able to swallow food. A. Mr. Kane's session will involve going over basic exercises to indicate his needs every day of the week. R. Mr. Kane should be able to regain some resemblance of independence to improve his mindset and to improve his condition. T. Mr. Kane will be able to communicate his basic needs within the first week, eventually gaining the ability to communicate more independently within 1 year.
So, the scope of practice for a nurse practitioner includes ordering, performing, and interpreting diagnostic slash laboratory tests. They can make diagnosis. They can initiate and manage treatment, which can include prescribing medication and or other treatments. They can counsel and educate patients and their families slash communities. So, nurse practitioners can work autonomously and in conjunction with other health professionals. And so, for Mr. Kane's case, they will be educating, and the overall goal is to make sure he knows how to take his prescriptions without help before he's discharged. So, for the SMART goals for the nurse practitioner, S, have Mr. Kane learn how to take his prescribed medication, when to get it, when to take it, getting them filled, so that he's able to take his medication without help at home. For M, for 1 to 2 months before he is discharged, Mr. Kane will physically demonstrate once a week, each week in a meeting, how he is taking his prescribed medication. He will then recite the directions to the nurse practitioner without help in the last 2 weeks before he's discharged to see if he has a good understanding of the directions. For A, monitoring Mr. Kane and his progress with each weekly meeting and making sure he is able to follow these directions carefully when taking his medication will allow practice for Mr. Kane until he can confidently take them without help from the staff. For R, in order for Mr. Kane to improve, the prescribed medication must be taken in order for him to be his wellness to be at its highest. For T, between 1 to 2 months before discharge, Mr. Kane should understand how to take medications as per directions and should be able to do so without help from staff before his discharge date.
The evaluation of care. We can measure the evaluation of Mr. Kane's health in the system by measuring Mr. Kane's trust, responsiveness, etc., measuring the quality of the health care at different points, evaluating Mr. Kane's confidence in self-care, and evaluating Mr. Kane's mental health.
The outcome of care. We can measure the outcome of Mr. Kane's progress by measuring Seeing that Mr. Kane is able to eat a proper diet, seeing that he feels more content physically and mentally while performing daily activities, we can see that he's able to communicate basic needs, and we can also measure if Mr. Kane's anxiety and depression will be decreased.
And then here are our resources.
So moving on, we are going into the discussion of the group process. For the first question, what is it like to set up patient care goals as a team?
To set up patient care goals as a team, we had to take under consideration the aspects of the care of the patient needed. For instance, we had to address certain health issues that Mr. Kane had and then decide what specialists he needed regarding what they deal with. For example, he became a patient of speech pathologist, physical therapist, neurologist, registered dietitian, etc. Overall, coming up with a plan was very simple after figuring out who he needed to start seeing.
Second question was, how did the team determine which of the various SMART goals that were developed were the goals you would ultimately choose for a team? So looking at the multiple professions, we bounced off different ideas of first going broad on focusing on the main issues Mr. Kane's facing with and how we need to slowly indulge into one center idea. And then from there, we slowly created our SMART goals, making sure they're specific and still pertain to the main issues.
And then what was easy and what was difficult. As a group, I find the easiest part was going over what was wrong with the patient and then figuring out what specialists he needed to see in order to get the right care to recovery, and then coming up with an overall goal. And then the difficult part of this project was trying to get everybody to meet up on Zoom the same time. Our schedules were very different, so that was a little bit hard. Was how did we negotiate the plan of care?
So we pretty much just, same as before, we bounced off our different ideas and saw what professions we needed, what treatment we needed, and we would go over each other's ideas, seeing if there needs to be anything added to it, anything that doesn't really pertain to it, etc. Fifth question was, how effective was your team in working as an interprofessional unit? So I'd say our team was fairly successful in working as an interprofessional unit. It was definitely more of a who can attend Zoom meetings, how our schedules align, but in creating the ideas, presenting our goals, seeing what treatments are needed, I me and the team felt that it was working effectively.
So the last question asked, describe relevant issues, beliefs, feelings, etc., related to IP, teamwork, and healthcare that came up for the team during this assignment. What did the team members learn from this assignment? So we felt and we believe that it was helpful to have people to talk to in our assignment. So it kind of mirrored what like an actual interprofessional team did. So it's like crucial to have the same exact sort of team to help one another out in a case like Mr. Kane's. And then we learned for this assignment that it's important to have other professionals' opinions in a patient's case because it's beneficial for the patient's outcome as a whole.